Good afternoon, everybody. My name is Sue Eustice. I'm from the California School Employees Association. I've been a member of CSEA since I was hired by Newark Unified School District 33 years ago. I have held many different positions in CSEA. I now chair the CSEA State Insurance Committee. Back in 1992, I became very interested in health care. I was the chapter president and head of our negotiating team. The district indicated it was no longer going to be able to afford to help pay our benefits. So with that, I decided that it was time for me as an individual to start to understand why there was such an increase in cost in health care at that time. At the end of that year, our district, we negotiated with our district to take us into basic trust. Basic trust was a jointly managed trust consisting of 8 other school districts. And with my surprise, I became a trustee. I'm not sure I was willing, but I became a trustee and was a trustee on that trust for 11 years. Yes, we held down the cost, but still health care continued to rise. CSEA has 230,000 members. 100,000 members are without health care benefits. They don't even qualify for them. So you can see the dilemma as each district who was used at one time having their benefits paid for 100% were starting to lose it. About 5 years ago, we moved from basic trust into California Value Trust, which has 203 school districts in it. It's a very large block. Still, our health care is starting to slip away, even being involved in Central Value Trust. Many of our members in the last 2 years within my chapter and other chapters, health care is becoming so increasingly high for them to even pay their portion of it, as they're dropping their kids off their plans, putting them into healthy families. At a point now that many of our members are dropping their spouses. They are only covering themselves because that's where they're limited to. Myself, after working for 34 years in the school district, I paid $120 last year for myself and my husband. This year I'm paying $240, even though we're in a very large trust.
That's per month?
That's a month, correct. And it's going to continue to rise to the point, I'm 65, I have a real concern as to whether I'm going to be able to continue to afford that. CSEA became involved in the single-payer movement in about 2003. Sheila Krull, at that time, presented a bill that was SB 840. We looked at it and suddenly we saw that this was maybe an answer to helping our members, and we have pursued with great interest SB 840, joining along with the Nurses Association in California. Our CSEA board took health care so seriously that they developed a 5-principle parameter that any health care bill that we would support, they would have to meet all 5 principles. The only bills that meet that so far is SB 840, which is now called SB 810, and HR 676. In 2006, the CSEA did a survey of our members to see how much knowledge they had about health care, single-payer, SB 840. To our surprise, most people really clearly didn't understand what single-payer was. Very confused. So the CSEA Insurance Committee developed a toolkit, which I put one on each of the chairs. We developed a toolkit to explain to our members what SB 840 was, what it would bring to them, questions that they might have, and a question and answer page. There was also one distilling myths. It was quite intensive. We went ahead as an insurance committee. We're assigned by areas. There's about 10 areas in the state of California. We went out and we started to go to what we call regional presidents meetings. There's about 100 of them. So each of the area insurance committee people had about 10 meetings to go to and to present this toolkit in SB 840. We also went to research negotiations workshops. We did a workshop at our annual conference. And at the end of that year, we were very pleased that it seemed, after doing another survey, that the increase of the knowledge for single payer was improving, but it still wasn't good enough. We decided after doing all that training that we needed to do more member on member. CSEA, in its wisdom, released 40 members that next year to go out into the school districts to educate on single payer. The purpose was to educate the chapter leaders, other union leaders that represent the school district employees, and school district management. We contacted more than 20,000 CSEA members. We used the toolkit to educate, and we used the single payer SB 840 as our going in to recruit for CSEA Victory Club. Our Victory Club is, I believe, what you call your COPE funds. So in Fresno alone, we increased our membership in our Victory Club by over 1,200 people. That was equally so throughout the whole state. At the end of that year, we polled to see what the knowledge was in support of SB 840 was for us. It was triple-fold of the year before. We know this works. In 2009, we continued to do the trainings wherever we could. We also developed a sheet where people could take and put their own district's figures into it to see how much their district would save. It was surprisingly, take LA Unified, it would just save them thousands and thousands of dollars. And so we used that as a tool and took that to our school boards along with a school board resolution promoting SB 840. In California, we've been able to pass SB 840 twice, and it has been vetoed twice by the governor. It is now called SB 810. Mark Leno has brought it forward, and we are continuing to support that. This year, CSEA has developed a sub-healthcare committee at a state level, which consists of 2 of our state board members, 2 of our insurance committee members, 4 of our field office directors, a number of people from staff, from governmental relations, public relations, and we've developed another plan for 2010. In 2010, we're going to train 100 regional representatives and 100 RPACs, which is the political action person in each of those regions. The regional representatives have monthly meetings with our chapter presidents. They're going to be training those chapter presidents with the toolkit. The presidents, in turn, are going to go back to their chapters. They're going to do training in their chapters, and they're going to be encouraged to be involved in a healthcare activity this year. An example might be a movie night showing Sicko or our DVD or One Care Now DVD. Another might be that they take and they rally. We just rallied last week in Sacramento, that they take their chapter in Sacramento and rally. Or that they would take, if they haven't already passed the school board resolution, take that school board resolution to their school board, get it passed, go to their city council, get it passed, and so on. The regional PACs this week are in Sacramento lobbying, and one of the things that they are lobbying is SB 810. And they are going to continue through the political action process to promote to our members and to any representatives in their areas SB 840. We have created an accountability matrix to measure the success at the end of this year. So I'm hoping that maybe I might be invited back next year and that I will have another success story. We firmly believe, we don't care if it takes another 5 years, another 10 years, we are going to pursue single payer until all of our members have the benefits of health care. Thank you.